Thanks so much, Dr. Altieri. Thank you to the SAGES Program Committee for the invitation to come and speak with you today. You may be able to discern early on in my talk that this is a topic about which I am particularly passionate, but I hope that you will find some takeaways, not only for your life after training, but things that may also help you maximize the most of your training right now. So without further ado, let's get started. I don't have any financial disclosures, but we just heard a wonderful talk about the differences between academic and private practice. I'm an academic surgeon. You already heard all the things that come along with that. Teaching, in my opinion, is a wonderful part of it, but is always a baked-in part of it. But you don't have to be an academic surgeon to be engaged in teaching. And it duplicated on the slide. Okay, these are the things that we're going to talk about. But I wanted to show you this study first. So the things that are most associated with favorable teaching ratings, 76% of the variability of being a great teacher is associated with a surgeon who maintains a positive attitude, who is calm and courteous, and who provides hands-on experiences to learners. So I am confident that all of you in the audience can do that, and that you can get amazing ratings from all of your learners by doing these three things. Okay, but I know that you're not gonna be satisfied and you're gonna wanna take it further, so here's how you can do that. Okay, education scholars tell us that these 4 conditions are the principles of learning that make it more likely to stick. When learning occurs in a way that it is problem-centered, so that you anchor it in your mind, it occurs in a supportive environment, it is oriented around an experience, and it is active learning. Okay, that's great and theoretical. How do we apply it in our everyday life? Okay, so the first thing is you want to orient your learners. You may remember as a medical student showing up on day 1, you've got your stuff, like, oh, where do I put my belongings? Okay, where even is the operating room? And you walk in and you don't put a hat on, all of these things, right? Hopefully someone has told you this, but sometimes they don't. And so just helping these individuals, all of your learners, understand that they are part of your team, where they can put their stuff, kind of how the day-to-day functions go, takes 5 minutes or less out of your day. And it makes a really big difference. The next thing is to set expectations and negotiate goals. And it turns out, you may realize, that people are going to rise to your expectations, whatever it is that you set for them. And so you want to negotiate 2 sides of this. One piece of this are the goals that you have for them, and the other piece are the goals that they have for their time with you. So when I was a resident, I used to sit my medical students down. I would meet them 10 minutes before the start of rounds. And sometimes that was painful because that was at 4:50 a.m., but I would do it anyway because it was really important. And we would have 4th-year medical students come on the service, and I would tell them, okay, you're gonna rotate on this service, and I want you to know how to do a good abdominal exam. I want you to know how to do a good pulse exam. Now, what do you want out of the rotation? And then, I would get, deer in the headlights looks. I'm like, look, you're a 4th-year student. I know that what you want is a letter of recommendation. Is that right? And then sheepish head nod. I said, okay, well then let me help you, and let's identify who you're gonna ask for that from, and let's set you up to have great experiences so that you can get a really positive letter. And boom, changes the whole dynamic immediately. Another example is now that I'm on the faculty, I sit down and meet with the residents before they start. And the last resident that was on our service, one of her goals was that she really wanted to work on her teaching skills. And so over the course of our time together, I tried to work and build in extra opportunities for her to have TA cases or to have more time to interact with our learners. But if we didn't have that conversation, I wouldn't have known that those were the things that they were going to work on, other than the 4th-year students, who we all know that they want letters. But we can help them out in that way. Okay, so your goals for them, their goals for the rotation. And this is going to come back again when it gets to talking about feedback. Okay, more practical tips. The whole thing about being problem-centered and being active rather than passive. So we all remember stories about patients. And so grounding something in a story about a patient or a real life scenario is much easier for people to remember than speaking in generalities, right? I'm an endocrine surgeon, and so rather than just asking you what the workup is for a thyroid nodule, we might talk about a specific patient that we saw in clinic. That's pretty common. Then you want to put the learner in your shoes and get them to commit to something, right? Get them to commit, like, what is the workup? What do you think is the diagnosis? What do you think is the treatment? Just one of those things. And your only commitment is to teach one general rule. Often, I used to think that teaching took a lot of my time out, right? If I'm going to start down this pathway of going through the workup of something, then I've got to complete the whole thing. But if you focus on just teaching one general rule, they will be more likely to remember it, and it will take you less time, and you can go back and revisit that same conversation and add another layer at your next interaction. Okay, here is the key thing. If you remember nothing else from what I say, I want you to remember this next thing. And that is because often we ask a question and we pause for about 2.5 seconds. And so once you ask the question, you need to be quiet. And this is very uncomfortable. Anybody feel uncomfortable yet? Okay, so you can imagine that if you ask a question and you just let it hang, your students are going to fill that silence. But often we start to feel uncomfortable first, and we ask the question and we just want to move on and fill in the gap. So if you remember nothing else, ask a question and just let it hang. Count to 10 slowly, okay, like the one Mississippi. And you will be amazed at the things that you learn that are going on in your trainees' minds. And then you can help to reinforce what was positive and correct anything that they may have a misunderstanding about. Okay, even still now, we don't always have time to go through that entire process and wait our 10 seconds of silence. And so if you are in a major rush and you have nothing else to offer, you can always think out loud through whatever it is. Maybe it's a really challenging part of the case. Maybe you have to take over. You can at least say, okay, well, these are the cues that I'm using to visualize the plane, and it's right here. Or I'm trying to spread, and I'm making sure that my tips are perpendicular to the tissue rather than parallel to the tissue, or whatever it is that you're doing. You can just narrate it as you're going, so they get some benefit of what's going on inside your mind. Okay, so based on the things that we've discussed already, I would like for you to consider at least one thing that you're going to start doing. Maybe it's an orientation conversation. Maybe one thing you're going to stop doing. For me, I like giving this talk because it reminds me I need to stop giving away the answers quickly. And then maybe something that you might already be doing that you're going to continue. Okay, strategies for teaching in the OR, and these work both ways. But I ask you to envision yourself as an early faculty member, and the person standing across the table from you, you've never met before. And so you might be thinking, ooh, well, this case really needs to be quick. And, ooh, how much can I trust this resident that I'm with? I've never worked with them before. So I offer you 2 strategies. So, and you can use these now, actually, in the reverse. So the first is the pre-briefing and debriefing. So before the case, talking to the person that you're operating with, figuring out how much of this have they done in the past, what parts do they feel comfortable with, and importantly, what's the thing they really want to focus on? And then if I'm really in a rush, then my obligation is to help them really take ownership of the thing that they really want to focus on. And if I really need to do the rest of the case, then I give myself permission to really just do the rest of the case. Importantly, after the operation is over, you want to debrief and give feedback about how the operation went, to identify what went well, what we can do better for next time. The next strategy I really love is called setting a timer. As you all may know, safe struggle is the way that people advance, right? You need to be given an opportunity to try to figure something out on your own and get past it. That is really hard when you're watching someone else struggle. And so one strategy that was taught to me is to set a timer. Say, okay, this looks like it's really tough. Have 2 more minutes. And if you can't get past it at 2 more minutes, then I'll take over, I'll get us past this. And then you gotta give the case back. That's the really important part, right? Because otherwise, like, that person's gonna be reluctant to engage in this type of interaction with you. And then I often try to give tips for how, in that 2 minutes that they've got, that they can move past it on their own. That's a really effective strategy. And you, as a trainee right now, if you're struggling, can just verbalize and say, I'm struggling right here. Can you give me 2 minutes to try to get past it on my own? And most of us would say, like, yeah, oh, I'm glad you realized you're struggling. Like, that's good insight. Okay. General strategy for feedback. Sorry, I'm going through all of these things quickly. I would be delighted to share these slides with you and or chat with you about any of these things afterward. I laugh every time I see the reference here because this is from a pathology journal. So it just means that the principles of good feedback are not any different depending on what field that you are in, right? So you want to, here's tip number 1 for your medical students in particular. You want to label this as feedback. I'd like to give you some feedback. You always want to try to do this in a relatively private location, ideally one-on-one. And then it's really a dialogue, and you want to reflect back. You'll see that bullet point number 3 is create shared goals. Well, hopefully you've already had the orientation conversation at the beginning, and you can reflect back to the goals that you shared for them or that they shared that they would like to do. And then you want to be constructive and detailed in the feedback. And this whole little thing, I think it's great, but it's hard to remember. So this is easier to remember. Ask, tell, ask. So ask, how do you think this is going? Or if we're talking about this in the context of an operation, what did we do well? What could we have done better? And I always get the learner's perspective about it first. And I force them to tell me something that went well, because everyone wants to start with telling me something that they did poorly. But it's just as important to focus on the things that you have done well so that you know to do those things again in the future. Then once I get their self-assessment, I provide my own assessment. I elaborate the points that I agree with their assessment. I add some additional detail or talk about areas that I disagree. And at the end, the ask is, where do we go from here? So what are we going to focus on that's different for next time? Or what are we going to do different next time? And this whole process usually takes about 3 or 4 minutes. So it doesn't have to take a long time out of your day. Okay, I wanted to throw this in here too, because I suspect that as you all finish training, and certainly over the last 2 years, many of us have had to adapt our teaching strategies to a virtual setting. And if you've ever done this before, you may realize that delivering a long lecture just really doesn't work over Zoom. You can do it, but what you'll find is that people's cameras are off, or they're checking their email or whatever. So a few strategies to sprinkle in interaction. If you have the nice purchased version of Zoom, you'll notice on the toolbar at the bottom, there's a feature called Annotate. You can turn that on and you can draw on your slides as you're giving a talk in order to direct and focus people's attention to a particular section. You can embed polls or chat. The polls take a little bit of advanced planning. The chat, you can ask questions, and then you can ask for people to respond. Sometimes I'll ask a question, and I'll say, okay, here's the question. I need 3 people to respond before I move on. And then I'm silent. And then if people aren't paying attention, they notice the silence, like that snaps them out of whatever they were doing, and then they're like, oh gosh, what did I miss? Did they call on me? It's pretty entertaining. There you go, my next point, use silence. You can always use silence to your advantage. And then just-in-time teaching can be accomplished with breakout rooms. By show of hands, who knows what just-in-time teaching is? Yes, okay. But I'm so excited I get to teach you all something today. So just-in-time teaching is where you figure out some way to assess the knowledge level of the learner, and you meet them there just in time with the content you're delivering. So usually this involves some sort of quiz. So when I did this in in-person lectures, I do this for hyperthyroidism, is my favorite. There's a quiz about hyperthyroidism. Everybody takes it. And then people get in groups and they come to a consensus about the best answer. So they have to talk to each other, and it's peer learning. Okay? So you can put people in breakout rooms, and then they can come to consensus answers. And then once they come to a consensus, each group presents their consensus. Like if it's A, B, C, D, it's multiple choice quiz, A, B, C, D. And if all the groups got the question right, I move on, because clearly everybody knows the right answer. I don't have to waste my time on all of the background stuff. And then whenever there is disagreement, we dive into that and we spend more time on the things that are unclear and that they really need to know. Okay, so you can still do that after your breakout rooms, review your answers on the deeper dive. Those are the muddiest points. All right, I'm gonna go quickly through documenting your efforts. Particularly important for anybody interested in an academic career. You wanna make sure that you're getting credit for all of these educational activities that you're doing. And so on my CV, this is how I document my teaching activities. I have a section about teaching in courses, about formal teaching of peers. So these are like at conferences, like case conferences that we hold on a weekly basis as an example. And then also a section for clinical supervisory and training responsibilities, like teaching on rounds, that sort of thing. And this gives an overview of your activities, but it does not give any sense of the impact this has had on your learners. And so if you want to provide more information, then you can put together something like a teaching portfolio. And in some institutions, something like this is really important for promotion. So it's good to start that early if that is the case. In it includes your educational philosophy, which is usually a few paragraphs. Evidence of your effectiveness as an educator. So your teaching activities, the comments that learners write about you, educational scholarship that you have done, educational leadership that you may have been involved in. It's more descriptive, and it includes all of the evidence for the things that you have. And I've got a link at the end. I see some people taking photos, so I'll make sure and put that up, of where you can get a copy of a template for a teaching portfolio. Okay, so key points. General principles, orient your learners. If you can do nothing else, talk out loud. Be quiet. Pre-brief and debrief in the OR. Set a timer and tell ask for your feedback. And all of you are going to be getting some amazing teaching awards. I can see it in your future. There's information if you ever want to contact me. But there's the link to the teaching portfolio. I'll leave that up. If you'll leave it up for just about 20 seconds, I would be appreciative. Thank you so much.